Hello, everybody, and welcome to our October webinar. We are covering today's topic, and that is Trump is anti-abortion, his second term agenda. So let's go ahead and get started. So, starting off, I'm going to introduce myself. I am Jessica Ensley. I use she, her pronouns. I am the Senior Vice President of Outreach here at Reproduction, and I'm based in DC, and I will pass it over to my co-host.
Hi, everyone. Thanks so much for being here. My name is Stephanie. I also use she, her pronouns. I am the DC organizer here at ReproAction, and I am also based in DC. I'll pass it back to Jessica.
Great, thank you. So here is an overview of our agenda today. I'm going to introduce the organization before that, and then next we'll go into the topic overview before we get to the panel discussion. We'll take care of some housekeeping items afterwards before we get into the Q&A section. And you can join our conversation by live posting at hashtag reproaction on Blue Sky. If at any point you have questions, please feel free to enter them into the question section of Zoom, and we will get to them at the end. So, a little bit about our organization. ReproAction leads bold action to increase access to abortion and advance reproductive justice. We are known for our left flank analysis, our willingness to hold folks on all sides accountable, whether they be allies or opposition, and we are committed to nonviolent direct action. Okay, so let's jump into today's topic. So I want to recap uh, Trump's first administration to overview all of the anti-abortion things he did there. So, the biggest one being he vowed to appoint Supreme Court justices to overturn Roe v. Wade, and he succeeded through his nominations of Neil Gorsuch, Brett Kavanaugh, and Amy Coney Barrett. And Roe v. Wade is no longer law of the land. He also implemented the global gag rule, which prohibited foreign aid from being used to perform or promote abortion as a method of family planning. And in his first election campaign, he did say that there should be, quote, some form of punishment for women who have abortions. While in office in his first administration, he advocated for a national 20-week abortion ban. And then he also instituted a Title IX gag rule, which barred Title IX providers from discussing abortion as an option for family planning. Next, we'll cover some of Trump and Project 2025's connections. So, Project 2025 is a federal policy agenda that was led primarily by the Heritage Foundation, but many other organizations as well. Heritage Foundation is a conservative think tank which has strong anti abortion policy goals and overall regressive, disconnected politics. Project 2025 called for a ban to ban and to criminalize abortion pill mifepristone, which is the first pill in abortion medication regimen. Project 2025 proposed ending EMTALA, which is the Emergency Medical Treatment and Active Labor Act, which could lead to denials for emergency life-saving abortion care. I'll touch a little bit on this later. It also proposed a federal mandate for states to report their abortion data and turn it over to the federal government, which could then increase the risk of criminalization of people seeking abortion care in those states. Project 2025 is and was, when it came out, wildly unpopular. So much so that during the re-election campaign, Trump attempted to distance himself from it, stating, quote, I have nothing to do with Project 2025. I haven't read it. I don't want to read it purposely. I'm not going to read it. But despite this claim, he has close ties to many of Project 2025's authors. Key author being Russ Vought, who is now the Office of Management and Budget Director. And in a Truth Social post from last month, Trump identified Vought as the quote of Project 2025 fame, very much showcasing that he lied during his reelection campaign, which is a trend. Next, I want to cover Trump's connection to IVF, especially with some of the news recently. So during his reelection campaign, Trump called himself, quote, the father of IVF and promised to make it free for US citizens. Recently, on October 16th, 2025, Trump announced a deal with a drug manufacturer and two specialty pharmacies to try to help lower the costs of IVF treatment. It is important to note that each round of IVF can cost anywhere from $15,000 to $20,000. And while lowering the cost of the drugs does help some, the majority of IVF costs, each round, come from labs, genetic testing, and procedures. In addition, this administration also signed a bill cutting funding for Medicaid, which in turn is going to raise insurance costs for all of Americans. Senator Elizabeth Warren released the following statement after the deal was announced, which puts this recent news fairly succinctly, and that is, quote, Trump's new genius plan is to rip away Americans' health insurance and gut the CDC's IVF team, then politely ask companies to add IVF coverage out of the goodness of their own hearts, with zero federal investment and no requirement for them to follow through. Next, I'm going to cover some of Trump's global anti-abortion moves um, in his second term. So, Trump's bill to slash global health funding passed in Congress, subsequently cutting $500 million from US funded reproductive health programming. The Trump administration also plans to destroy $10 million in already purchased birth control intended for women in low income countries. So, to be clear, this is birth control that is already paid for and being housed in Europe, I believe in Belgium. There have been offers from foundations to buy it out or receive it as donations at no cost to the United States. Instead, the Trump administration intends to spend $167,000 in our tax dollars to just destroy it all. He reinstated the global gag rule. And lastly, he cut funding and staffing for other global health initiatives, including the President's Emergency Plan for AIDS Relief, the CDC's Maternal and Child Health Branch, and Global Health Center. So, rounding out this portion, um, Trump signed a bill that slashed $800 billion dollars. One of the major cuts of that bill is going to come at the expense of Medicaid access and defunding Planned Parenthood through removing Medicaid access to them, despite the fact that Medicaid is not and hasn't ever been used to cover abortion costs. Instead, this new bill that Trump signed is going to leave 1.1 million patients losing access to their Medicaid at Planned Parenthood. And these are appointments that can be used for contraceptives, whole women's wellness appointments that need to happen annually, and a myriad of other reproductive care that Planned Parenthood offers. And coming back to EMTALA, the state of Idaho refused to treat patients needing emergency abortions to save their lives or avoid serious health risks. And again, that is against the federal policy of EMTALA. So, under the Biden administration, they took up legal action to try to fight Idaho against this. And then when Trump came into office, he just simply dropped the suit that the DOJ had been pursuing. So, we see here that Trump is very much continuing the Project 2025 agenda that during his reelection campaign he claimed he had no knowledge of. With that, I'm going to pass it over to Stephanie to cover Trump administration and mifepristone.
All right, thank you, Jessica. Yeah, so we're gonna basically just kind of build on what Jessica was talking about, and relate it a little bit more to mifepristone access, which has been in the news a lot the past few years. So just for a little bit of background, mifepristone is one of two drugs taken during a medication abortion, the other being misoprostol. It has been FDA approved for 25 years, proven to be safe and effective for ending a pregnancy. Um, Despite this, the Trump administration has taken quite volatile steps to restrict mifepristone access. So most recently, they cited a non-peer-reviewed report from the conservative think tank Ethics and Public Policy Center to justify a request for the FDA to re-review the safety of mifepristone. Again, despite a mounting of peer-reviewed evidence to suggest that it is safe and effective for use. A review of the drug by the FDA, despite it being over 96% effective, could result in further restrictions in accessibility. This could include restrictions on telehealth care, on gestational limits for use, amongst others. This was also kind of in tandem with a very illogical press conference the same week by Trump and Robert F. Kennedy Jr., who is the health secretary, linking Tylenol use during pregnancy to autism spectrum disorder, despite no evidence existing for any such link. And so clearly during the same week, they were really kind of utilizing the same playbook on mifepristone that they were using on other FDA-approved drugs, such as Tylenol. And since then, it's actually important to note here that the anti-abortion movement has actually expressed some discontent with Trump's abortion moves. This is because around a similar time, the FDA also approved a new generic mifepristone pill for use. But we really want to be clear here. This was not a Trump administration action, despite what the anti-abortion movement might think. The application for approval of this particular pill was submitted 4 years ago, meaning that this was simply the FDA process working as intended. And this had nothing to do with the Trump administration or Robert F. Kennedy Jr.'s actions. So it's really clear that all of Trump's actions thus far on mifepristone have been, again, pretty volatile. If you want to go to the next slide, Jessica, a little bit more information on this to suggest his opinions on mifepristone. Under Trump's discretion, they also conducted an assessment with the EPA, so the Environmental Protection Agency, about whether they could develop methods for detecting abortion pill traces in wastewater. This was based on claims that were basically spewed by the anti-abortion group Students for Life of America. So in a letter to the Trump administration from Students for Life, they had, previous to this, they had urged the EPA to take action on quote unquote pollution of mifepristone in wastewater sources. And after the EPA very strangely responded to this request and conducted these assessments, Students for Life actually commended the administration for quote unquote, their dedication to protecting life and safeguarding public health. In tandem with this, the Trump admin has also backpedaled on a lot of research advancements that came out during the Biden administration on mifepristone. The Trump admin has since stated that the Biden admin twisted the data that came out on the drug safety and efficacy, and once again has sort of begun backpedaling on a lot of those research advancements. So it's pretty clear that a lot of these kind of baseless claims about mifepristone under Trump's oversights have just sort of suggested an appeasement of the anti-abortion rhetoric. And they have clearly followed suit in a lot of their top campaign issues, particularly the wastewater pollution, amongst others. And I will pass it back to you, Jessica.
Thank you, Stephanie. Appreciate your overview of the Trump administration and mifepristone. So it is my pleasure to introduce our first panelist, Natasha Roy, who is the staff editor at Rewire News Group. Natasha edits stories and newsletters about reproductive justice, LGBTQ plus rights, and campus issues. Natasha, thank you so much for joining us today.
Hi, thank you for having me.
My first question for you is you, along with your colleague at Rewire, Cameron Oakes, have done really extensive coverage of the Trump administration's attack on all of our freedoms, including reproductive care. Could you give us an overview of some of the most and least surprising moves this administration has made in an attempt to turn back the clock on abortion, birth control, and fertility access?
Yeah, so I think there's not a ton that we've been super taken aback by since the conservative legal movement really laid out their policy goals in extreme detail in Project 2025. But I think what's been the most surprising is the speed with which the administration is moving. Trump has clearly been more organized in his second term than in his first. And we're seeing a really outsized, influence from right-wing groups. Advocates have warned for a really long time that birth control is on the table, but we're seeing these anti-abortion groups really gain ground on labeling birth control and other things like that as abortifacients, and then also weaponizing social media to undermine trust in basic science. And that's really ramped up this term. I think something else that's been kind of surprising is Trump's recent announcements on IVF. We kind of went over the basics of it, but it's been really unpopular on both sides of the political spectrum. A lot of left-leaning people and Democrats don't think that the policies do enough. And then right-wing folks are unhappy with it because they think IVF is immoral, and they don't like the idea of, eggs being destroyed when they don't get used in IVF cycles, because they see it as, a violation of fetal personhood. And a few of the less surprising things that he's done have been, reinstating the global gag rule. My former colleague, Garnet Henderson, did some really great reporting on this for us. But every Republican president since Ronald Reagan has reinstated it, and then it gets rescinded every single time a Democrat is president. But Trump's global gag rule from his first term was really notable in that it applied to all global health funding, rather than just family planning programs. So it applied to, stuff like HIV prevention and nutrition programs. And then Marco Rubio also had us rejoin the Geneva Convention, which is this international joint statement signed by about like 34 countries, including us, Brazil, and Hungary. And it basically says that there is no international right to abortion. So, when we see the Trump administration doing stuff like this, experts aren't so surprised it's happening. But I think what is really surprising is the scale. It's not just that we're re-implementing a bunch of rules that past Republican presidents have also done, but this administration is doing so while cutting international funding and aid at unprecedented levels.
Yeah, thank you so much for walking us through those items. And it has been happening at such rapid speed. Trump has been in office, oh gosh, what, like 9 months now, and it's felt like an eternity. So definitely a lot has happened. Um, my next question is about Project 2025. I touched base on this a little bit earlier, but after over a year of denying any ties to Project 2025, Trump had recently admitted that this was his template for his second term. So what did this policy agenda lay out that appears to have come to fruition or is in the planning stages within the Trump administration that you've seen?
Yeah, so they've accomplished quite a lot this year, and it's only been a few months. One of the big goals that comes to mind is the cutting off of Planned Parenthood's Medicaid funding. We saw Republicans in Congress get this done in the quote unquote big beautiful bill. And that issue is sort of flip-flopped in the courts, but right now the administration is allowed to continue to cut off Medicaid funding to Planned Parenthood while those legal challenges proceed. But a maybe unintended impact is that we're seeing is that this specific part of the legislation is having an effect on other clinics. My colleague Cameron Oakes has been following this healthcare clinic network in Maine called Maine Family Planning. They are the largest network of sexual and reproductive healthcare providers in that state. And because of the Big Beautiful Bill's anti-abortion provisions, they actually had to recently close their primary care practice and discharge about 800 patients, even though they're going to continue their sexual and reproductive health care. And similar to Planned Parenthood, they are appealing a ruling that allowed the Trump administration to continue to cut off their Medicaid funding, and that litigation is also still going on. Another part of Project 2025 could target providers' ability to mail birth control and abortion pills. So they don't explicitly name the Comstock Act, but they certainly refer to it. It's this 1873 anti-vice law that in part prohibits the mailing of quote unquote obscene materials, which could include anything that could cause an abortion. So, in Project 2025, the Heritage Foundation recommends that the Department of Justice enforce existing federal law that prohibits mailing abortifacients. And that could obviously include abortion pills like misoprostol and mifepristone, which is also under attack. But some parts of the anti-abortion movement mislabel birth control as abortifacients, and Project 2025 specifically calls the birth control method Ella an abortifacient. So experts are and have been concerned for a while that Comstock could get invoked at any given time, because even though it's considered this dormant law, and it has been since Roe v. Wade was overturned, or sorry, since Roe v. Wade was passed, now that Roe's overturned, it could be used since Congress has not repealed it in full. And just to touch on Intala a little bit more, you know, in its guidance, Project 2025 recommends that Congress pass legislation that requires infants who, quote unquote, survive an abortion should be treated, and it would also impose criminal charges for abortion providers. So there's this idea that, given redistricting fights this year that are trying to add more Republicans to Congress, the legislation that Project 2025 is suggesting could actually come to life. So we're keeping an eye on that next year during the midterms, then also during next week's elections.
Thank you so much for overviewing some of those really important items. And thank you so much for touching on the Comstock Act, because that is very important to note and something that folks should be aware of. I also wanted to flag to your note of, we know that anti-abortion opponents often try to conflate abortion with contraceptives, both of which are part of fully comprehensive reproductive care, and neither which should be demonized at all. But we have a previous webinar. If folks are interested, you can check that out on our website, breaking down the difference between emergency birth control and abortion. So, my final question for you right now, Natasha, is you recently wrote a really great piece about Trump's promotion of the unproven link between Tylenol and pregnancy usage and autism rates. As stated before, this is an unproven, unscientific claim. So my question for you is, what do you think this signals for the Trump administration's view on anti-scientific stances surrounding pregnancy and how pregnant people are seemingly responsible for any and all pregnancy and child health outcomes?
Yeah, so I think that there are two parts to this issue. These anti-scientific views are both really confusing to people, but they could also lead to really real legal consequences. So we're certainly seeing that people who follow junk science and hold anti-scientific views are being elevated to top positions in this administration. Obviously, people like Robert F. Kennedy Jr., who leads the Department of Health and Human Services. And that department has certainly seen a lot of chaos and confusion in the last few months. Even though the FDA recently approved a second generic form of mifepristone, Kennedy said he's going to order a review of the drug's safety, even though it's been approved for more than 20 years. And we're also seeing that, the CDC panel that recommends childhood vaccine schedules decided to change those recommendations for the measles, mumps, rubella, and varicella vaccines. And it also changed guidance for COVID vaccines for kids and pregnant people, even though major public health organizations recommend those vaccines for those groups. And experts have warned over and over again that when these policies change rapidly, it can lead to a lot of confusion and mistrust. And it can also just make it harder for people to get care, whether it's, pregnancy care for a wanted pregnancy or birth control. And on the second part of that, people are already being targeted for the outcomes of their pregnancies. And I think a lot of experts and advocates are worried that this is going to lead to a lot of pregnant people and their providers being criminalized for pregnancy outcomes. This was already happening before Trump took office. The nonprofit Pregnancy Justice just put out a report that found more than 400 people were charged with pregnancy-related crimes in the 2 years after the Dobbs decision. And in that, more than 30 of those cases were against people who miscarried or experienced stillbirths. And at least 9 people were accused of looking into or attempting or even just getting an abortion. And so, like I said, people are worried that pregnant folks are going to get prosecuted for their pregnancies. But I think beyond that, there's a concern that this is going to lead to people not seeking care when they need it, and also leading to them not trusting their doctors when they recommend certain treatments, or, birth control options for them. And in turn, people might get sicker than they otherwise would, or they might have adverse pregnancy outcomes, when they might not.
Yeah, thank you so much for walking us through those ties and how criminalization of pregnancy outcomes has already been happening. I want to encourage folks to read Natasha's piece about the recent announcement on Tylenol, and then her and her colleague Cameron Oak's other work on the administration. And to reiterate your point, yes, it does cause a ton of confusion. Natasha and I spoke about this last week. I happened to have an OBGYN appointment about 2 days after that press conference took place, and I asked my gynecologist, and they said every single patient that has come in has asked and been concerned about Tylenol usage, despite the fact that it is the only acetaminophen is only the only safe pain medication to take during pregnancy. So it is unfortunately having horrific real world consequences that are making people and providers alike trying to scramble to come up with solutions to share accurate and scientific information. Natasha, thank you so much for being on this webinar today. If folks have questions for Natasha or our other panelists, please feel free to enter them in the chat. We'll get to them at the end. And with that, I'm going to pass it over to my co-host to introduce our next panelist.
All right. Thank you so much, Jessica. And thank you, Natasha, for some amazing insight. We're going to move to our next panelist, as Jessica mentioned, who is Amy Friedrich-Karnick. Amy, thank you so much for being here. We're really excited to have you.
Thank you for having me.
So Amy comes to us from the Guttmacher Institute, where she is the Director of Federal Policy. So a little bit of her background. Amy joined Guttmacher in 2023. She leads the team focused on sexual and reproductive health and rights policy in the US at the federal level, advocating with Congress and the administration for policies informed by facts and evidence in support of a progressive vision. Previously, she was the Vice President of Advocacy and Communications at Women Heart, where she oversaw the organization's policy, advocacy, and comms efforts to advance support and access to care for women living with and at risk for heart disease. Prior to that, she was the Senior Federal Policy Advisor at the Center for Reproductive Rights, where she focused on developing strategies to ensure protection for reproductive rights and access to reproductive health care in the US, including overseeing the Act for Women campaign. Prior to that, Ms. Friedrich-Karnick used her skills as a consultant advising nonprofit clients, and also spent some time on the Hill working for Representative Jan Schakowsky. She received a Master of Public Policy degree from UCLA, and currently she is on the board of directors for Repro Rising Virginia Foundation. So Amy, once again, thanks for being here. Clearly you are our resident expert on repro policy. So really excited to ask you some questions. I will get right into it. So our first question for you, kind of building off of what we talked a little bit about earlier and with Natasha, as Jessica mentioned, during Trump's reelection campaign, he called himself, quote unquote, the father of IVF. And just recently, as we've covered, he announced a plan to slightly lower the cost of IVF. So for our audience, could you dive a little bit into how this administration attempts to make themselves a titan for IVF while at the same time doing pretty much little to nothing to increase cost and accessibility for fertility care?
Sure. And I think this is such a fascinating issue to kind of watch, at least from like a political perspective, because as you said, during the campaign, I would say Trump kind of glommed onto this fertility issue as part of a response to the Arkansas case that came out during the campaign time, when the Arkansas Supreme Court said, basically advanced the idea of personhood and threw fertility care and IVF into chaos in that state, And recognizing that a lot of people need fertility care. This is something that Trump kind of got onto, and as you said, kind of described himself as the father of IVF, quote unquote. So since taking office, he has done a couple of things to make it look like he's taking action. He issued an executive order back in February that kind of promised to address the challenges with access to fertility care and IVF. And then, as you mentioned a couple of weeks ago, he kind of made a big to-do to announce that he was working with the pharmaceutical company to lower costs on some fertility medications, and to say that the administration was expanding the opportunity for employers to offer supplemental IVF coverage in a way that's kind of maybe similar to how you would get your dental or vision coverage. Notably, and I think you said this too, it comes with no incentives or requirements that employers to do something about this. So really, it does little to nothing to address the very real challenges that many people face when they're trying to access fertility treatment. And that's actually not surprising in any way. And I was actually quite intentional to essentially do nothing. This wasn't so much of a surprise, but it was interesting to read a recent Politico article, basically dove deeply into how aggressively the anti-abortion movement lobbied the administration to make sure that they actually did nothing to either require the government to cover access to fertility care, that they did nothing to require insurance companies to cover it, because as Natasha so clearly laid out earlier, the anti-abortion movement is opposed to IVF. And so Trump is playing this game where he's appeasing the anti-abortion movement by not really doing anything, but also trying to be perceived by the public as caring and doing something about this. And what we know is that not only is he doing nothing to advance access to IVF or fertility care, he's also doing all of this in the context of all these other attacks on healthcare that has already been laid out earlier in this call around Medicaid and Planned Parenthood, and really attacking all these different ways that people get their healthcare and their SRHR. Of course, as part of the very original DOGE effort back in January, February, they eviscerated the staff at the CDC that work on fertility care. And they're doing other things, what they call, when it comes to fertility care and IVF, what they're calling kind of a holistic approach to infertility, or quote unquote restorative reproductive medicine. They actually provided a grant opportunity earlier this year through the Title X program for anyone to start an infertility training center. And this is the idea where you that focusing on kind of what they call the root causes of infertility, things like teaching women about their menstrual cycle as a way to combat infertility, things that independently aren't necessarily bad, but really don't advance people's access to fertility treatment. And in this kind of way, ACOG, the association that oversees OBGYNs, has called restorative reproductive medicine unproven and not based in science. And then, of course, this is all just happening in the context of a pro-natalist movement right now, where, and you hear this in Trump talking about just wanting more babies. We just want more quote unquote beautiful babies. But you'll note, and it's again not surprising, that in all of this, this rhetoric around IVF, it is not mentioning single parents. It is not mentioning the LGBTQ community or others who really do need support and access to fertility treatment. And it's just, it's clear that if there are any policies around this, that those communities and those folks are not included. So again, you have this dichotomy of trying to act like the administration is doing something about it when really they're doing nothing, and they're actually sliding back access to the care that would be needed.
Yeah, thank you so much, Amy. I think that's some really good insight, and really appreciated that you kind of named, Trump's sort of sneaky moves with the anti-abortion movement that we were kind of talking about earlier. Even though at face value, it seems like he's kind of a little bit wishy-washy about IVF. It's pretty clear that he's working hand in hand with the anti-abortion advocates. So really appreciate that insight. My next question for you, I know that you at Guttmacher and elsewhere have done a lot of research about sort of recent Trump admin moves. So in addition to IVF, the Trump administration has erased a wide berth of government websites that included published and publicly available research on reproductive care, Can you go over a little bit about what has been removed, and what does this warn us about the future of government-funded scientific data on reproductive care?
Yeah, I mean, I think it's a surprise to no one that the theme of this administration really has been a clear attack on science and on facts and on data, on evidence-based research, all of this. So right after the administration took office, within those first few weeks, there were several websites for the federal government that were taken down pretty quickly. And these included a lot of CDC data sources, behavioral risk resurvey research that organizations like Guttmacher rely on, and several others were taken down quite abruptly. And researchers in the field of SRHR and beyond were quickly trying to, grab and download and save and archive everything they possibly could. Some of those sites came back online relatively quickly after, and so some of those data sources that originally were gone are back. But there are definitely some very interesting exceptions, and also there was lawsuits that happened right away trying to bring some of those pages back up. So, for example, there's the PRAMS research. This is the Pregnancy Risk Assessment Monitoring System that is run by the CDC. It's a state-based surveillance project that collects data related to maternal health. And so it's ongoing collecting data from states around maternal attitudes and behaviors around pregnancy, and feeds a lot into the work we do at the federal, state, and local level to reduce maternal and infant mortality and morbidity. So it's a really bipartisan, important research program looking at maternal health. That's one of those research sites that came back online because of a court order. And as I was, getting ready to have this conversation today, I was looking at the page, and I think it's just both horrifying and fascinating what this government is doing. If you go to the data page for PRAMS of the CDC website, it literally says in, a big banner across the top, per a court order, HHS is required to restore this website to this version as of January 29th, 2025. Goes on to say a few things, and then it says, any information on this page promoting gender ideology is extremely inaccurate and disconnected from the truth. The Trump administration rejects gender ideology due to the harms and divisiveness it causes. This page does not reflect reality, and therefore the administration and this department reject it. So that is the message you're seeing when you show up on a CDC website that has to do with research related to pregnancy. You get the same notice at the top of another site in CDC that is the Youth Risk Behavior Surveillance System. You have other pages like School Health Policies and Practices Study. And if you go to that page, it's just an archive. And so it's there from whatever existed before 2025, but it's clear that there's nothing else new. So you're seeing this across the board. I think what's is particularly scary is it's happening in tandem with getting rid of the workforce that would be overseeing and contributing to all of this research. So we're not just losing the website itself or the access to the data. We know that the administration riffed almost most of the workers in the CDC Division of Reproductive Health, which oversees all of this research, and infertility care as well, which I mentioned before. They oversee contraception guidance for healthcare providers and all of that. So even if those programs maybe are funded on paper or they haven't been anything affirmatively to eliminate their existence, there's no staff that are working on it. And then just a couple of weeks ago, they also riffed almost the entire Office of Population Affairs and HHS, which oversees Title X. So all of this is just where we could end up in the next 1 to 2 to 4 years and beyond from this administration, and the lack of what we're going to lose by not having these researchers and others track health trends, inform evidence-based policies and programs. I mean, it's just hard to quantify how many steps backward we're taking by really erasing the research and the science and the ability to really understand how all these policies are playing out and the impact they're having, because we just won't have that level of research that a federal government really normally should be able to provide.
Yeah, thank you again, Amy. I think that was a perfect summary of kind of what we're seeing. And I think that I totally agree. There's a lot of kind of back and forth, especially with legal moves, about what we're seeing regarding research and websites available. But as you said, even the ones that are, forced to remain available, we're seeing really hostile messaging from the Trump administration that can be really dangerous for folks who are viewing these sites and need to access this kind of information. So, really appreciate you naming that. So clearly, we've talked a lot about throughout this webinar about, kind of attack after attack that the Trump admin has gone after on a wide variety of research, publicly available data, or just healthcare generally when it comes to abortion and reproductive care. So in your opinion, what do you think is really on the horizon of the Trump administration's next attack on reproductive care? Or, is it simply kind of just too tumultuous of an administration to even guess?
Well, I would say both. There's probably things that are up their sleeve that we can't guess, but there are definitely a lot of things that we are tracking and watching and expecting at some point. I think, as you said earlier, we're only, 10 months in. I do think, and I won't repeat it all, but I do think all of what you shared earlier about access to mifepristone and the attacks in multiple ways that could play out, whether it's through the Comstock Act, like Natasha mentioned, and the ability to be able to ship and send medication abortion to pharmacies and to patients, or if it's kind of through attacks through the FDA and through the courts and other ways. I think that we are watching very, very closely all of these attacks on mifepristone. And it's really because what we know from our research is that 63% of people in the US who are accessing care through clinicians are using medication abortion. So this is really why it's such a big target of the anti-abortion movement, is because they know that is how, 2/3 of folks are receiving their abortion care. I also think it's just important to reiterate the attacks on contraception, and specifically around the Planned Parenthood defund, which was mentioned earlier. Technically, in the law that was passed, it only defunds Planned Parenthood for 1 year when it comes to Medicaid restrictions, but we know that there are lots of plans in the works in Congress to extend that. So we're really afraid that would be extended longer. And even in the case that we're living through now, we know a lot of clinics are already closing down because of that restriction. So keeping a close eye on that. Same with Title X. I mean, this is another way, a lot of publicly funded clinics are either getting patients and paying for the care because the patients are covered by Medicaid, or they're getting Title X funds. And even though technically Title X funding is still in the books, they ripped the entire staff a couple weeks ago. So we will be keeping a close eye to see how that plays out once the government reopens and how they plan to keep that program going. And then, of course, with the Medicaid cuts that will be going into effect over the coming months, people's access to care is really going to be diminished if they are covered by Medicaid. So all of those those attacks on contraception in the way that we attack those programs and people's access to care. And then just also add from a global perspective, because you did mention the global gag rule earlier. We are expecting in the next month or so the Trump administration to finally roll out its fully expanded version of the global gag rule, which they've previewed a little bit here and there, but that it promises to go much further than any version before, and really not just apply to global health, but we anticipate that will apply to all foreign aid that would be going out the door and expand beyond just putting restrictions on abortion care and access, but restrictions on gender ideology, restrictions on DEI. It could apply to bilateral agreements between two countries who are coordinating aid. So it promises to be a gross expansion of what we've seen before and could have a tremendous impact on people's access to SRHR around the world. So those are all just a few of the examples of what we're watching for the weeks and months to come.
Yeah, thank you for laying that out, Amy. I think it's pretty clear that there's a very wide variety of things to look out for, and things are very rapidly changing. And I think, as you mentioned, I think it's really important to note that even where we do still have access and we do still see things expanding, like birth control options and abortion care options, it's really hard for these things to be implemented and to become accessible because a lot of clinics just don't have the funding or don't have the capacity right now to remain open, or they don't have the research team to be able to make these accessibility campaigns happen. So I think you put it really well that there's a lot of moving parts here, and we really appreciate your insight. So thank you so much, Amy. Really happy to have you here. And I will pass it back to Jessica to wrap us up.
Thank you both so much. And I'm going to cover some housekeeping items before we get to the Q&A. So if folks have questions, please enter them in now. Just flagging, you can plug into our ReproAction campaigns at www.reproaction.org. And on all social media platforms, we are at ReproAction, most active on Meta platforms and Blue Sky. And save the date for our next Act and Learn webinar. Who is Students for Life of America? That's going to take place on Thursday, November 20th at 2 p.m. Eastern Standard Time. Okay, and now we're in the Q&A section. So my first question, I'm going to pass it to Natasha first, and then Amy. What are some effective ways people have been fighting back against these regressive policies, whether it be through legislation, the courts, or grassroots movements?
Yeah, I think we're seeing a lot of, local and state level initiatives to protect abortion rights, and to protect birth control. Some states are even, stocking up on mifepristone and on birth control. To shout out my colleague Cameron Oakes again, she did a really great piece in December before Trump took office about how people can try to, protect their own reproductive rights by stocking up on mifepristone, by stocking up on over-the-counter birth control, and how you can keep that safe for both yourself or anyone around you who might need it.
And I can just add to that. I think there's obviously a lot that we're advocating that state legislatures do, whether it's helping to backfill some of the defunding of Planned Parenthood in the meantime, or if it's looking at some of the Medicaid cuts that we expect down the road and making sure that they can mitigate those as much as possible. So there's those types of state level advocacy. I would say for individuals and folks on the call right now, they're as was mentioned earlier, there's so much misinformation out there, whether it's about contraceptive methods, whether it's about the legality and accessibility of abortion care, that I would say to the extent that folks listening have good sources of information, whether it's ReproAction or other organizations, that you just continue to kind of uplift that and be the source in your community for folks as a go-to for quality, true, evidence-based information. So, if people need to figure out how to access abortion medication or, find out is their clinic still open or not, all of that kind of thing. I mean, anything we can all do to really combat misinformation and help spread the truth, because there are so many attacks and so much going on, but there is still a lot of access. There are still clinics open in places. There is still a lot of access to abortion care. Sometimes that comes with different kinds of risks depending where you live, but being that source of information, I think is hugely important. And then continuing to give to the organizations that are fighting back against this administration. I think I take some hope every time I feel like people are still showing up, whether it's with their bodies at protests or online or signing on things or sending letters to their elected officials. All of that still really matters, that we continue to use our voice.
Great, thank you both so much. Amy, I'm going to ask you to expand a little bit upon what you just noted. What would be some reliable sources of information via the web that you would recommend folks check out?
Well, there's the website I Need an A if you're looking for, I think it's .org maybe, I'm not sure. But for finding access to to abortion care services. I think that's a good one-stop shop. I mean, there's always, I mean, if you really want to get into the data and the research and the analysis, there's, of course, guttmacher.org. Our website has a lot, but it's, maybe it's a lot of information, a lot of data there, but it's a great source. Kind of depends what you're looking for. I can kind of share out and afterwards some other websites and things, but I think it's, whether it's news sources that you really can trust, or kind of these websites that are organizations that are based in the same values in the movement that have good information. That's kind of what I would start with.
Great, thank you so much. My next question is for Natasha. Natasha, you touched briefly on the Comstock Act and the threat that poses. Can you dive a little bit deeper into that?
Yeah, totally. So I think the thing about Comstock is that there have been attempts over the years to repeal it. There was just an attempt last year, but it kind of hasn't gone anywhere. And it was used in, the 1800s, basically up until Roe was decided, to restrict, the mailing of abortion pills. And as Amy said, medication abortions account for 2/3 of all abortions in the United States. And, as some of my colleagues and other advocates have noted, it could really be used to impose a de facto federal abortion ban, even if Congress never passes any legislation. And, parts of the Comstock Act have been repealed. They repealed the birth control provision a few decades ago, but the abortion one has not been repealed still, and it doesn't seem like there's really any movement, frankly, to do so. So yeah, I think the scary thing is because it's just been dormant and it still exists, it's still federal law. They do bring it up in Project 2025. Since the Trump administration seems to have been following those guidelines to a T, I think, there's a concern that this is going to come up. And something I've been thinking about is, Trump has, bragged about placing justices on the Supreme Court who could overturn Roe. And while his first administration was definitely not friendly to reproductive rights, this is the first time he's been president since Roe has been overturned. And he has a lot more leeway now. So Comstock is a really powerful tool there. And it can be used in conjunction with other laws. We just ran a story actually about Americans United for Life, an anti-abortion group, proposed in January that prosecutors should use Comstock and RICO, the Anti-Racketeering Act, in conjunction to go after abortion funds, which is how a lot of people are able to afford to travel for abortion care if they live in an abortion hostile state. So I think that, now that we have an administration that is friendly to anti-abortion movements, anti-abortion groups, and these laws that could be weaponized, we might start seeing that pop up for the next few years.
Absolutely. Something to definitely keep watch of and be wary of. Thank you very much for breaking it down a little bit more for our audience. My next question is for Amy. I love that you had noted and looked out today some of the flags on government websites. How do you find that? Are you frequently like combing through all of these websites, or do you do like regular checks? How do you find which ones have been taken down or put back up or have those types of updates on them?
Well, I am privileged enough to work at an organization with dozens of researchers who rely on the data. So I am able to rely on them. And all of this, I think if you kind of know about some of these big research projects, it's all very easily available. So I was able to reach out to some of my colleagues who normally rely on these data sources regularly to see kind of what's the status and where things are at. So, I mean, for those who are really curious, I could imagine a deep dive into CDC's website of sexual and reproductive health, and just Googling CDC reproductive health, CDC birth control, things like that, and scroll around. But these are, and I can also share it after some of the big kind of research projects that are available underwards. But our colleagues regularly kind of are checking and seeing what's happening in the research space with all of this data.
Absolutely. And huge shout out to all the other researchers at Guttmacher doing such great work. The next question is for Natasha. Where is that article posted regarding Comstock and weaponizing other laws like RICO? Was it everywhere or somewhere else?
Yeah, that Rewire. We published it, I think, a week or two ago. I can drop it in the chat here. But yeah, it basically looks at the different ways that RICO kind of quietly has been used on a local level in conjunction with the Comstock Act to try to go after abortion funds. But it's so far untested on a wider scale.
Great, thank you. My final question for you both, and I'll pass it to Amy first. How can people support your work?
Um, Well, I would be remiss if I didn't say make a donation to Guttmacher because my development colleagues would tell me to do that. So again, I think I would say obviously yes, you can go to guttmacher.org and make a donation, but really also just probably follow us on all of the different social media channels. I think we're actually newly on TikTok now. A lot of what we're doing is trying to bring evidence-based work and our policy expertise to combating mis and disinformation, as I mentioned before. So we hope to have a lot of content that is not just for a research audience, but is accessible and friendly to all kinds of people. So follow us and please do share the content that we have. And yeah, we would appreciate it.
Yeah, I'll echo that on our end. Rewire is also a nonprofit. I think our development team would also be very happy. You know, with any donations that can kind of help fund our work. And, just reading our work, engaging with it is really helpful. And also, it's really important to us to be doing science-based, fact-based work, especially in this era of so much mis and disinformation. So just engaging with the work, and, once you do, really going to sources like Guttmacher to see if you can get any more research in. But I think, you know, being more informed is the best way to kind of combat, what we're all dealing with right now.
Absolutely. And if people checked out the small sections of citations in our presentation today, a lot of it went back to work that Amy and Natasha and their colleagues at Guttmacher and Rewire had done. So thank you both so much for taking the time out of your busy schedules to walk us through such an overreaching topic and walking us through your expertise. Thank you to our audience for attending, and thank you to my co-host Stephanie for helping me put this webinar together. Appreciate everybody, and I hope you all have a great rest of your Tuesday. Take care, everybody. Bye.
Thanks
Thank
all. Have a good
you.
one.